In this video, we will discuss about DVT and Coumadin. We will talk about what DVT is and what causes it, things you should look out for to know if you have DVT, and complications of the disease. We will also talk about Coumadin, specifically what it is and what it's used for, its side effects of using it, and possible complications of using the drug.
According to the CDC, DVT afflicts roughly 300,000 to 900,000 Americans annually. Deep vein thrombosis is an ailment which a thrombus develops within a vein deep under the skin. They usually form in the lower leg and thigh, but they may also develop in the pelvis and arm. Symptoms of this disorder include swelling, discoloration, and scaling of the affected limb. Although 50% of the people who have DVT won't experience any symptoms. DVT is caused by slow blood flow to the extremities, which can result from inactivity or a low activity level lifestyle. The second cause of DVT is blood with a higher tendency of clotting, like patients with thrombophilia or hypercoagulability. The last cause would be an injury to the lining of a vein.
One of the most serious complications of DVT is pulmonary embolism. This occurs when a blood clot becomes lodged in one of the pulmonary arteries of the lung. This is a potentially fatal condition that blocks blood flow to the lungs. Shortness of breath, sudden chest pain, and coughing up or vomiting blood are all possible indications of pulmonary embolism. If you experience any of these symptoms, seek immediate medical attention. Another common complication of DVT is post-thrombotic syndrome. This is a chronic condition that can last for years after having DVT. DVT can cause high blood pressure in the veins of the affected area, which can then lead to damage to blood valves and long-lasting impairment. Symptoms of post-thrombotic syndrome include limb pain, swelling, changes in skin color, rashes, sores, and ulcer formation.
Coumadin is a trade name for the drug warfarin. This medication is an anticoagulant medication, which just means this drug is going to help prevent clots from forming in your blood vessels. Some side effects or things we would expect to happen when someone is taking Coumadin is dermal necrosis, cramps, nausea, and fever. Dermal necrosis refers to the death of living tissue. Some signs to look for that indicate dermal necrosis are pain, bleeding into the skin, blood blisters, and a rash. Abdominal cramps and nausea are also expected side effects along with fever. Abdominal cramping is usually when you experience pain in the muscles of your abdomen. Nausea is the feeling or urge to vomit. And a fever is usually indicative of sweating, chills and shivering, headache, irritability, and overall general weakness.
There are also more severe complications you should look out for. One common adverse effect is calciphylaxis, or cell death of the skin. Signs and symptoms of this condition include pain, burning, itching, or blistering at the site of lesion. Another complication that might occur is bleeding. This can be seen in bleeding of the gums, tarry black stools, or unusual bruising. Notify your healthcare provider if any of the previously stated adverse effects occur. Make sure you take your medication as directed. Inform your healthcare provider of any missed doses or double doses. Moderate your vitamin K intake, as this vitamin works against the effects of Coumadin. Avoid consumption of alcohol or over-the-counter drugs without getting approval from a healthcare professional.
Tell your healthcare provider or HCP if you missed a dose and do not take double doses. Make sure to follow the directions when taking the medications. Watch your vitamin K intake and avoid alcohol or taking over-the-counter drugs without approval from your HCP. Call your HCP if any adverse side effects happen. Avoid being in one position for a very long time, and if you have any questions or concerns, please call your HCP.